changing the hand position to change the load going through the abdominals, and that's how you get your grade. All right, Sarman has a curl-up different design where he changes the position of the legs, so you can see how a curl-up can be more nuanced. But we have to know the typical manual muscle test way of doing this. All right, so that was one of the comments on this test versus the manual muscle test. Now, go ahead and lay down. So while we're doing this, back up a little bit. What? Sorry. Okay. All right. So now, what are we going to do to progress this, or try and unpack the assessment of this? And part of what we're doing is we're doing a strength breakout, but you're seeing how we can look at some of the qualitative aspects that we went over, the timing, the initiation timing, and strategy, to show that someone is not moving in the proper way. So we need to change it so they move the right way. Right? So we saw Alyssa's hip flexion dominant pattern for a curl up. So Christina has a different pattern. All right, so we're just going to take a look at this, because what we can do is we can follow through with two different pathways of treatment. For Alyssa, we would do some movement pattern timing training to try and change the pattern, because the strength and endurance was fine. But for Christina, what we're going to do is we're going to watch the abdominals, and I'm going to palpate here. So start and just curl up just to where the shoulder blades come off the back. Okay? So what are we seeing the hip flexion that we saw from Alyssa? Not really.
Her pelvis.
So what did you see?
Her pelvis, like.
Which way? Popping up?
No, posterior.
Or,
Can you do it again?
oh no,
Posterior.
popping down.
One more time.
Yeah.
Going posterior. Yeah.
Christina.
Okay. So start to come up again.
Hey, it's a smart kid.
Oh, wow.
It's a smart kid. Is it okay if I pull this up a little bit?
Working for it.
So one of the things that we're going to look at is the contour again. Okay. Now start to come up. Now remember, what is the initiation? What should happen first? Transabs should draw in. So what's happening here? Rectus abdominis is pushing out. So I think I see that, but now let's palpate. I'll come in here and I'm going to palpate and now start to come up. Straight away, even before she started to lift, I felt the push out. We didn't do deep muscle assessment, we'll do it in a minute. But what I want to feel is the draw in. I don't want to feel the push out. The push out is a oblique contraction. When transabs contract, they draw in. Okay? So the timing strategy is off. So let's work on that.
What?
So imagine a line between the ASIS, drawing that together, and then draw it towards the spine. So that was actually pretty good. Initially that didn't work, we had to change it up, and we said, okay, imagine a line from the pubic bone to the spine. Good, and now layer on drawing these 2 points together. Keep that draw in, and now start to lift up. Oh, best, it was already better than before. So we still see it though. But what we did see was a correction of the timing. The transabs drew in, we didn't get the push out, but then once she started to load it up, that's when the push out happened. Okay? So I did cueing, and it helped a bit. It helped the initiation, but did it change the task?
Not really.
Not really. So what is the washout conclusion when cueing doesn't really help?
Biomechanical strategies.
Well, let's say nothing that we do helps, that it still presents weak.
Strength.
So it's weakness. Okay, we're in a strength breakout. So now, when we're going here, we do the cueing, okay, draw in, and now start to come up. And then it pushes out. So either she won't get all the way up, but she's getting up, she's whipping up there, but it's pushing out. So part of what's happening is the deep abdominal is too weak to be able to successfully perform this task. With Alyssa, when we cued her and got her out of her hip flexors, she was able to curl all the way up. So it wasn't a weakness problem. We need some strength training here. But this is too high a load, so how can we make this less of a load?
Bend the knees.
That would change the strategy. How can we make this less of a load on her body?
Oh, arms.
Inside line?
That's a big jump. That would be a decrease in load, but we don't need to go that far down.
Isn't that what you said in the beginning, the arm position?
And the legs?
You could do it standing and add resistance, but what's in between standing and lying totally supine? Incline. This was the hint when I checked which side was up. Okay. Okay. Flat. Still the same. Okay. So now there's less. We've decreased the moment arm of gravity, so she's able to curl up from here. Okay. So now, do your draw in. Nice drawing. And it might be more difficult for you guys to see, but the push out is better. Okay, now relax, tilt the pelvis, just shake it out. You gotta want people to start kind of in a relaxed position so they're not starting overfired. Now draw in. Okay. Rotate the hips a little bit, keep the draw in. Okay, good. It's a really good drawing. Okay, now start to curl up just a little bit and back down. So now you're gonna draw in, keep the draw in, and imagine a line from this bone right here, your xiphoid, and this is starting to pull you forward as you curl towards your pubic bone. Draw in, there, and now start to curl, right there, and come back down. So you're overcompensating with your head flexing, which is cueing your rectus abdominis. So don't go that far.
Okay.
Okay, so you're gonna do a draw in, and now you're gonna start to curl. And that's it. And you go a little higher. All right, so sit up.
Then you do, so this is your motor control, this is your breakout. Now you're doing.
So we're in a strength breakout. We're in a strength breakout, and the washout was we needed to do strength training, but doing it in supine was too high load. So how do we decrease the challenge of any strength exercise? Decrease the load. If you try and curl 100 pounds and you can't get your 6 to 12 reps, how do you get your 6 to 12 reps?
Less weight.
Drop down the load. So same thing here, but dropping down the load takes some creativity because we can't peel away the weight of her head. We can't take her head off.
And the cueing is just, it's assisting in what you want to activate.
The cueing is just making sure the timing happens the right way, but the washout was we can't just do motor control training, we have to do strength training, and that's what we're trying to do right now. But even with strength training, form is part of strength training. So we're using cueing to improve the form and the timing.
Thank you.
Okay? Wiggle the pelvis, relax. Good. Tilt back and forth. That was a wiggle, you're right. Alright, so draw in. Excellent drawing, excellent. And now, imagine that line from here to the pubic bone, start to curl, and the shoulder blades come off the bed. There we go, hold, 2, 3, down. Okay, draw in, and curl, hold, there we go, right there, that's it, that's all you can go. See, when she tries to go beyond that, it pushes right out, and then back down. So this would be a good place to start, okay? And we can do the strength training of a curl here, so that she starts to build up the strength to be able to curl up. The other way that we could do it, sit up. Give me a little arch in your back. Okay, holding right there. Now, draw in here. No deflection. Draw in. Good. Now you're going to start to let your pelvis come back to the bed. Keep your shoulders up. Good. This is working better. You okay?
Yeah.
Tough, right?
Just thinking.
Yeah. Come back up. Good.
It doesn't feel like hard, it just feels,
Do you feel the shaking?
not really.
No? Alright, we have a motor control issue. Alright, time to curl back. Curl back, curl back. I gotta torture a little bit. Keep going, keep going, keep going.
Now, so I
Okay, hold. Now come back up. And sit up. Okay, so what I'm doing is I'm getting creative. This is part of a curl down. And I'm emphasizing the abdominals as she's tucking in order to get back to the point that we could lean back into a full curl down. All right, so this is another way to start to strengthen the abdominals and initiate the tuck. Now, initially Christina didn't feel the shaking, but I felt the shaking the whole time, so I know that the muscles were really working hard. All right, but you're used to compensating with big guys, so those were the ones you were looking for.
yeah.
But if we take away the big guys and we target the little ones, and then you're getting good work at the little ones, it might not feel like strainful work to your patient, but you're getting the muscle that you need, and that's the one that you want to ultimately strengthen.
And education-wise, that's what you say to them. You're like, I know you can't feel this because people get frustrated, so you just, I know you can't feel this, but you just have to, exactly what you just said.
So you got to give them something to connect to. That's why I tortured her a little bit, pushed her further back into it so she could feel either the shaking or the work, or you show them in the mirror what's happening. Look at when you compensate, how you just brace this way. Or look, now it's a smooth curve, but it's difficult to control. That's why you're doing that. Yeah.
Do you want to like eliminate the cervical thoracic
Yes.
neck flexion?
Yep. So she's compensating by whipping the head forward, and whipping the head forward doesn't flex the lumbar spine, but it gives you overflow into the abdominals. So then all of a sudden the rectus abdominis grabs. So you take that out of the picture so you can help to isolate the rectus abdominis.
What was your verbal cue for the drawing?
So that's what we did for the lumbar, where it was between the ASISs drawing together, people go in the spine, or as if you're zipping up tight jeans. That's to preset the deep abdominal muscles.
And then do you just say keep a melon under your chin or something, like if
Oh,
they-
that's another one that you could do, yeah.
Like that, like
Yep.
something, okay.
Yeah, so if you want to prevent the flexion give, you can make them aware of the distance from chin to chest and stop them from flexing through there. So that's an excellent another strategy. Okay? All right. Thank you.
Dr. Rodriguez, this is very similar, to Pilates.